it's CJ. Congratulations on the birth of your baby. Today I'm going to tell you 7 symptoms that you should never ever ignore in the postpartum period. I'll also let you know what you should do if you are having those symptoms. Please keep in mind these are in no particular order. Number 1, infection. If your temperature is at or above 100.4 Fahrenheit or 38 degrees Celsius. If you have an incision that is red, swollen, hot to the touch. If there's foul-smelling discharge coming from that incision, you most likely have an infection. If that happens during the day, please call your OB provider. If it happens at night or on the weekend, go to your local emergency room for evaluation and treatment. Number 2, preeclampsia, which can actually occur up to 6 weeks after you have your baby. If you are having the worst headache of your life, it won't go away no matter what you do. Changes in your vision, black spots, flashing lights, tunnel vision, severe abdominal pain. If you have a sudden onset of severe swelling, you may very well have preeclampsia. That is something that needs to be evaluated right away. You can call your OB's office, but most likely they will tell you to go to the emergency room for evaluation. Number 3, mastitis, which is an infection within your breast. If your breast is red, hot to the touch, extremely painful. If you have a fever and you don't feel well, you may very well have mastitis. Unfortunately, untreated mastitis can actually permanently damage your breast tissue. So if you are having these symptoms and it's during the day, call your OB provider. If it is at night or on the weekends, please go to the emergency room for evaluation and treatment. Number 4, heavy bleeding. After you deliver, for the first couple of days, your bleeding may be a little bit heavy, and then it should taper off to that of a normal menstrual cycle. If at any time you are bleeding heavy enough to saturate a pad in an hour, or if you are passing blood clots that are bigger than an egg, that is an emergency and you need to go to the emergency room for evaluation right away. Number 5, DVT or deep vein thrombosis. In the first month after you have a baby, you are still hypercoagulable, at greater risk to develop blood clots. If you are having pain in one leg and not the other, and that pain was not prompted by an injury, if that leg is red, swollen, hot to the touch, and very tender, that could very well be a DVT, and you need to go to your local emergency room for evaluation of that. Number 6, if you are having chest pain with or without shortness of breath, that is a medical emergency. You need to go straight to your emergency room. And number 7, if you are having worsening depression or anxiety symptoms for the first week or 2 after you have your baby, you're tired, your hormones are fluctuating, it is very common to have the baby blues. However, if you cannot stop crying, if you wish the world would go away, if you have thoughts of harming yourself or your baby, that's not okay. You need to go to your local emergency room for evaluation as soon as absolutely possible. I do hope that this information has been helpful, and that if you have any questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or better yet, even share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.